Depression, Marcia's story. Marcia is a 38-year-old woman who works as an accountant. Usually, she enjoys her job. But for the past 2 months, she's been having difficulty with a coworker who has not been doing his work and has instead been telling their boss that it's Marcia's fault that their team is behind on deadlines. Over the past month, Marcia has noticed that her mood has been gradually getting more depressed. She isn't enjoying things like she used to. She feels guilty about not spending more time with her cat Felix, but she has no energy to play with him. When she tries, she finds that she just can't keep her mind on what they're doing. She is spending the day sleeping and eating. In fact, she's sleeping whenever she doesn't have to be at work, and she's gained 15 pounds in the past 2 months. She's so sad these days that she thinks that Felix would be better off if she just faded away. Marcia's friends have grown very concerned about her. They bring her to a psychiatric clinic. The clinic nurse does an assessment and notes that Marcia's hair is matted and dirty in places. Her posture is bent, and her shoulders are rounded. Her speech is soft in volume, and she seems slow to respond to questions. Her thoughts are coherent and linear. However, her thought content is full of negative associations to everyday events. For example, when asked about her job, she describes feeling that she's a failure because she's falling behind on her work. Her mood is depressed. Her affect is sad with some blunting. She endorses passive suicidal ideation, though denies homicidal ideation, hallucinations, or delusions. Marcia reports that this isn't the first time that she's had these symptoms. She's had 2 previous episodes like this, once when she left home to go to college, and once when a relationship ended about 5 years ago. Her mother also used to have episodes of depression like Marcia's currently experiencing. At the psychiatrist's office, Marcia is prescribed an SSRI, Prozac 10 milligrams. She's instructed to increase it to 20 milligrams in 1 week and check in with the nurse at that time. Marcia understands that she will probably not see results from the medicine for several weeks. However, her psychiatric team wants to make sure in 1 week that she isn't having side effects, such as anxiety, sedation or insomnia, nausea, constipation, sexual dysfunction, or worsening depression or thoughts of suicide. Marcia is also beginning to work with a psychotherapist doing cognitive behavioral therapy, or CBT. In CBT, she's learning how her thoughts affect her mood and behaviors. By working on and identifying and changing thought patterns that she's developed while being depressed, Marcia's been able to develop a more balanced perspective on her situation and combat negative thinking. Within a few weeks, Marcia's feeling better, and within a few months, Marcia's found that she's feeling much less depressed. Her energy is back to normal, she feels like she can think clearly, she's begun to engage in the hobbies that she enjoys, and she's returned to spending quality time with Felix and her friends. She feels that her life has a spark back, and she's back to feeling pleased to be alive.
Created using Powtoon.